I'm Terry Simmons, and you're listening to KTVS3's DocTalk. This is the place to be to hear informative, forward-thinking, solution-based discussions about what contributes to our mental health and our overall well-being. And you can download a new episode every Wednesday morning wherever you listen to podcasts. And joining us today is Dr. Catherine Vanderloos. We're going to be talking some more about menopause, mental health, everything that contributes to that. And this time I think we're going to be talking about moving forward, the things we can do to get out ahead of mental health, how it affects menopause, how menopause affects mental health. And as always, thank you so much for being here,
You're
Dr.
welcome.
Vanderloos.
Thank you.
Oh, we really appreciate this. Thank you
Thanks.
for giving us your time and for coming back again. We have a few other episodes out there. I hope there will be several more.
Great.
And so let's talk about this time about how to get out ahead of it, like we said, how we can stay kind of forward thinking, realize it as our mental health, things that we've always known, but now to kind of emphasize.
Well, I think some of it is just kind of being aware of your own self and what's happening in your world. If there are changes, try to focus a little bit. I think the mindful meditation things, and not everybody can sit and do all, 30 minutes or an hour, but even 5 or 10 minutes to focus and say, what is it that's different or bothering me? What is not where I want it to be? Where did I want to be and it's not there? I think that's a big part too, because you get busy with family and life and you're the last on the list, because that's what you do. That's what women do. So I think if people are not sleeping well, everyone talks about weight gain, which is the frustration of everybody and society even. But our bodies change as we start to go through menopause. And prior to menopause, we have fat around the periphery, outer parts of us, because we're feeding babies and growing babies. And then when we don't have our hormones, somehow that body knows it and it goes central, and which is very bad for us, because then our risk of heart disease goes with the guys, and that's not one of the things we want. So I think guarding against that a little bit, although it's very difficult to do. I myself lost weight twice because I just thought whatever I'm weighing when I'm 50 is where I'm going to be. And somehow I came up with that idea, and but it sneaks back up on you. And then, of course, Mom told us, you can't eat like you used to. You just won't do it. And of course, she was right. So Mom's right again. Yeah.
I love that. And let's talk about, where I do a lot of work, as you do too. We talk about mindfulness and meditation and how important our words are, by calling it mental health, not mental illness, even though it is an illness to be treated if we have mental illness. Separate of menopause and everything else, we need to give that the credit that it is, but also to talk about mental health and tell ourselves mental health. We're working toward what's going right.
Well, I think that's important. I think it's also important. I don't like the word disease or illness, either one, because most of the time it's just a different stage that you're in. And most people go through it, but everybody goes through it differently. So, I have patients and I say, well, I think, the periods are getting a little lighter and you're starting to have some hot flashes. Maybe you're starting to peek in the window of menopause. And they look so disappointed. And so I think what I do is I tell them, no, it's very liberating. Because I think it is, and especially when it's going to be a third of our life. Because if we live to 90, we've outlived our ovaries 30 or 40 years. That's a big deal. And it's a big, different medical deal, I think. So I think, preparing yourself, focusing, and you should be allowed to do it. And I think some of all the equipment, all the phone time we have and stuff like that, it can be productive, but it can be very negative. And, FaceTime is notorious for showing all the happy trips that they're taking. And why can't you do that? Why can't you get away? All that kind of reason. And in fact, no, they're having the same stuff you're having. They're just not showing it. And so too much of the screen time. Now, I've found little apps for, I'm sorry, that's my phone ringing.
Can you get it?
It'll stop.
Okay. It's very pleasant, though.
It is. It's crickets. Now I forgot where I was.
A lot of FaceTime. It's okay to have FaceTime and screen time.
So I didn't plan that. The apps, I have a sweet app it's a meditation, and it's 5 minutes.
Yes.
And all you do is sit there in the quiet and preferably in the dark, and you're just thinking about yourself, and they talk you through, and it's the most pleasant 5 minutes you can spend. And I think it calms down the nerve endings, because all these things are happening in the world, because now we know everything in the world thanks to the TVs, which was not is not a bad thing because we needed to know what's happening, and even now we don't know all the bad things. But we need to be able to help, and so, but you can internalize it, and it really is terrible. I mean, it can interfere with your sleep. I'm sorry.
It's okay. It's like perfect timing. If you need to get it, you can. It's like Dr. Van Lith, this is like real life. But actually, it's like pleasant. And are you sure you didn't cue that up because it's right when
sure
we need
came
it?
in just when we needed it.
It's
Yes.
very relaxing. This is evidence that if you just find
some crickets.
Listen to it for a few minutes.
Actually, it goes back to how I chose that. Is there was a McDonald's toy when my kids were small that you got, and it was a little cricket, and you could flip its wing, and it would make the sound. And I kept it in my pocket, and when I'd be walking around the malls with my teenagers, I'd flip the cricket, and they would just have this horrible look on their face. It was so fun. It was one of the little.
Was joyful for you.
It was joyful
and
for
healthy
me
because it raised your vibration. I love that you flipped the cricket. I meant have to use that term.
It's a good one. It's a good one.
Flip the cricket next time I need to go. And I do. I'm a big proponent of meditation. I'm a meditation teacher. I've been doing it myself every morning for over 20 years. And there's all other things out there too. EFT. I'm a tapping practitioner where we do tapping and emotion of freedom techniques. So there's so many things out there.
Well, and all the different kinds of yogas.
Yes,
that's
yoga.
just awesome. And that gives you a lot of physical, it's actually a lot of physical work. It's like flexibility, which we all start to lose. And so I think having those things. Now, you have to dedicate a little time.
Yes.
And, of course, when my family was younger, my time was 4:30 in the morning. Well, you just got up and did, that was my time.
Me too.
And so if we went on a trip and I slept in, which I never did, they checked my breathing.
That's wrong.
That's right. But I think, that's part of it. And that's part of just good mental health is kind of stopping and saying, what is it that's really bothering me? Is it something that I need to really worry about and get going and do something? And I also talk about breaking things into little pieces and attacking one thing at a time. It's much easier to do a quarter of something than the whole thing if it's really wearing you down. And I think that treating menopause is kind of doing that too. Because if you just have a few symptoms and it's not bothersome, that's okay. But if things are starting to bother you or really are bothering you but you didn't think about it being menopause, treating that can make a difference. I mean, just starting a little hormone, and I always follow up in a few weeks. One, because it makes the patient make sure she fills her prescription and takes some. Because, people are famous for not needing a refill because they never filled it to
there's
begin
two
with.
steps to getting that medication.
Yeah, exactly.
You have to take it.
The most effective is the one that the patient can take. But I follow up because I tell them, my goal is to make sure this is working well for you. Great, we picked well. Or if it's not, we have other options, or we can add things or change things around. And I do that with antidepressants too. And I think, not going to a pill for the first treatment, working with counseling. Many people already have counselors. I say make an appointment, kind of thing. Or I'll have counselors call and say, I think she really needs some medication. And, sometimes they know that patient better than I do in those cases. So I think being willing and aware that you can take these. Now, if you have the antidepressants, anti-anxiety, Paxil, for example, is approved in a much smaller dose for treating hot flashes. And so it takes longer. So you have to tell the patient it might be 8 weeks. Kind of thing. But it can work very well. And for my menopausal patients or breast cancer and, their symptoms are really being exacerbated by their medications, that can make a big difference. Celexa is another one I do for depression, and it's been used for hot flashes. And sometimes, depression is just a time of life where things are changing, but then menopause makes it come out or makes it feel worse. Or they don't even think it's depression, they think it's just menopause. Well, so we start with one thing, and if it's more the sleep thing, we'll fix the sleep up. If you're still depressed, maybe you need something. So, so I think that's how you can be proactive. Now, the exercise thing, I was a big exerciser for a very long time. My daughter did CrossFit, so I followed along with her. It was kind of crazy. I didn't do anything like they did, but I thought I did more than most of my compatriots. So anyway, so I think that's a big deal. And as we get older, we know exercise is the one thing that can reduce dementia the most, and that's the thing we fear the most. So so it's a big deal. And so preparation, thinking about it, being thoughtful, being a little aggressive if you need to be, but not, but letting it go along if it's not. And some patients just drift off and say, I never had any of those symptoms. And I'm like, that's great. I'm really pleased. But let's look at your bone density. Let's look at some things that may be a risk since you're not on your hormones now. Because the greatest bone loss is the first 5 years into menopause. And so that's why it's important to get a baseline bone density. You have to check with your insurers because not all of them, they all want to wait till you're 60, and by that time your 5 years has gone by quite a ways. So if you already have loss, well, now maybe we could have started something sooner and saved a fracture.
Yeah, and that's the point of bone density. Tell us again, because I know back in the day you didn't really go get that. It wasn't a routine to get bone density
It wasn't because, one, we didn't have the machines.
Yeah.
Then the machines came along, and we had to slowly figure out. One, we had to learn bones are very slow, so you don't do comparison studies very close to each other. If something is a little decreased, if it's abnormal, then you go down, you check it in 2 years, and if it's normal, you can wait a 4 years interval. Osteoporosis is where, if you're thinking of a building being built, you have the big mainframe girders, and then you have the floors and walls. In osteoporosis, you start to lose your floors and your walls, which are part of the structure and part of the support. And if you lose enough of it, the girders start to crush in, and that's what a fracture is. So the first medications, and we still use them, was bones. You get new bone, and it slowly goes away. And so the first medications block the bone from going away. But we were concerned, it's old bone, it's not new bone, is that going to be good? Well, it was enough to decrease fracture rate, and that's huge. So now they've gone on to different ones, and of course some of the medicines, there's side effects, you can have stomach irritation, stuff like that. So, but science has marched on, so we have lots of different ones. We have Prolia that's just twice a year injectable. That's easy to take. I mean, the original bone medicines were a pill every day, and you had to sit upright for an hour so it wouldn't irritate your esophagus.
Oh my goodness.
Yeah, and we were excited when we only had to do it once a week.
Yeah.
And then there was a once a month pill. So and there are other ways. They've learned a lot more about bone health and bone function. But if I have someone who's having menopausal symptoms, I can tell her if she chooses to use estrogen or if we add testosterone, that's going to help with her bone health. It's not an indication because we have bone medicines, so we treat bones with bone medicine, but they will get some added attraction, or if they're a new start and they're kind of borderline, because you can have bone loss called osteopenia before you get the actual porosis, which is where the walls collapse. And so if you're in that osteopenic and then we start some estrogen, many times you could see it come back up or just stabilize. And in bones, you have to be happy if it stabilizes. You may never get it back up, but you keep it from going down. Yeah.
Okay. And tell us about the machine. What happens at a bone density test? Is it like going through a tube like an MRI kind of thing?
There's different machines. There's the big machines. I had one at one point because nobody had them. They didn't have them at the hospital, so we put one in my office.
You're going to get her done,
forward.
Dr. B.
And so I thought one-stop shopping. And then you find out down the road a few years they can't do two things on the same day to be covered by insurance. So, oh my God!
Okay.
But by that time the hospital had one. So originally, it's a scanner, so they scan your lower back and your hip, and try to come up with a number. And it's not the number that means so much; it's the estimate of fracture by those numbers, and mainly it's in white females, and that's where the studies were for a long time because that's who fractured is white females. And so then they started doing them on younger people, and everybody said, whoa, wait a minute, we don't even know if they have fracture rate and a number on a 20-year-old versus, and you have the same number on a 60-year-old. There's a lot of science, and people have careers in bone medicine. So, not everybody could have the big machine, so they had some peripheral ones. They would do the heel, they'll do the wrist. Sometimes they still do those if people have rods, if they had surgery on their backs and they have rods or pins, because the machine, destroy the machine. And then also the machines, if you're over 300 pounds, you can't have a bone density.
Okay.
It's just not the machine doesn't like it. So they will try to do different things. So again, for that patient, it's a big deal. We got to work on the weight because I had one patient, we worked on weight loss just so she could get her bone density done. That was our goal. And then she kept on going for other reasons, but it was one of those. And of course, all her joints felt so much better when she lost weight. It was huge. And of course, obesity, nobody has a clue how much obesity affects every body system. And so that's a whole new world, a whole big world, and we're just kind of tapping in on it.
It really is. And it's also another thing that rolls into mental health too, with your weight and the shame and the body shaming, and there just should be none of that.
It shouldn't be allowed.
It is something that, go for help if you're uncomfortable. And plus, you don't realize a lot of times everything that it is going to help, diseases in your body or whatever is going on in your body, that will be eliminated with weight loss, things that happen so quickly.
And I use that sometimes, especially if someone is starting to look like they're becoming diabetic.
Yes.
And the threat of being on insulin is really a big mover. And sometimes I'll say, well, but we got to get with it and lose the weight, because you may not, because the insulin resistance may not be there if we get your weight down, and there's less fat cells doing that. And so you just kind of have to pick your spots to focus on, but you can usually find one. And sometimes I always say we have to find a carrot to keep going. And is it a wedding in a year? Is it no insulin? All those kinds of things, or just being able to move around. Because once you weigh so much, your feet, your knees, everything starts having trouble. So it's a big overall thing.
Yeah, and I think it's such a good focus. A good thing that we have always recognized mental health. We always recognize that we need to pinpoint things that will motivate or inspire someone to do something. But the emphasis now, so as we recognize it, but now it's the emphasis is on individual again. If low weight, or high weight is something that might be interfering with your daily happiness and functioning in life, let's look at it instead of just saying, you just need to drop the weight. Now it's different. It's really people saying, let's get that off. But you do have to find what is important to that person.
Right.
Like you said, you just keep going till the find that has to click.
It's
which
a
goes
big
again
deal, and I think also follow-up too is a big deal. And so I see people every month. I think if you're going to truly do intensive weight loss, you need to see them every day, once a week or twice a week, and you have, dietitians and all this stuff. And I mean, it can work, but the reality is people are working and they have trouble making it once a month. But we try to make it count. And so, we weigh, we measure, we go through what's going on with the eating, but what's going on in your life too. And and if your son came home from Afghanistan for 2 weeks and you ate yourself through the South with him, you're not going to lose weight on that thing. But it was an important mental health thing. So, so I think you always have to sit and look at it. Everything's multifactorial. It's never simple.
Yeah, and it's really important to forgive yourself on those days, and it sounds like that's what happens. If someone comes, because I think that anybody's been on a weight program where they want the help, they're yes, I'll listen to you, I'll come in and get weight, I promise. And then that day where something happened and you maybe did go to food for comfort, you're going to weigh a little more, you didn't lose, you don't want to go in, you don't want to face the scale in front of other people. No one wants to go in. It's lovely when you go in and you've lost a pound, everybody's like, yay. But we have to really, those are the days we really need to say, that's perfectly fine. And gaining 1 pound or 2 pounds or 5 pounds really quickly or on a day, or you're blown off by, or if the number is really something that bothers you, you gotta let that be okay. Then just start anew. You know what you need to do. It felt really good. It's progress, not perfection.
And I also tell people you didn't gain it in a day.
Yeah.
And sometimes it's been over 2 years, and you have to look at what was happening. Was COVID? Was this? Was that? All things kind of changed, and so I think that's really important. But I think good sleep's a whole nother world.
And it's we don't realize really what that means.
So obesity is linked with sleep apnea, and if you've got a patient with fatigue, that you've corrected her hormones and she's still really tired and she doesn't have anemia and her thyroid is fine, I get them to go to a sleep study. And sometimes you can tell because they're overweight, but I've had not really thin people, but I've had modestly slightly overweight people, but they had sleep apnea. And so that's again, you wake yourself up so you never get into REM sleep. And so it's a chronic fatigue that it was just, you can't go to work because you're so tired. And so, again, correcting the hormones makes a difference, but correcting the weight, correcting the sleep. I had one patient who the oxygen should be in the 90s, and when she did her little test, it was like in the 60s. And I mean, she really scared my poor sleep specialist. But she said, she thanked me for sending her because she could go to the grocery store without having such fatigue she couldn't stay and pay for the groceries. I mean, that's really, life altering. And so, and let alone that she could have died, kind of thing. So, but I think, always thinking about things, what's impacting what is really important.
Yeah, that's the main thing. Just pay attention. If it is impacting your daily life and your emotions, then go see about it. It's your life.
And find some little way to change things. It doesn't have to be a big thing, but find some way. Now, I think the other is set a goal for yourself. And sometimes if it's a younger person, I say, where do you want to be in 5 years or 10 years? And and maybe the decisions you're making now may not be so easy, but if it's for the good goal, then it's worth putting up with some aggravation now. Yeah. So I think that's kind of, and working with menopause, whether to take something or not, if it's really bothersome, you just don't want to feel that way. And so we can get you through it. Most people stop having most of the symptoms maybe by age 60, early 60s. But I have a few patients, even though we've got them on a lower dose, they still have sleep and hot flashes in their 80s. And so there's been a big push to stop hormones in their 60s, and that was kind of initiated due to money, as usual. But the North American Menopause Society, which I'm a member, and actually some of the phone thing is my meetings are going on, so I'm watching them on the phone. But they have actually put out a statement, and I looked back, and it was in 2016. And they had a long list of, yes, it's risk versus benefit, but it's still at the discretion of the patient and the physician. And if the patient's not having symptoms, we don't give it, or we taper off, and if they don't need it, they don't use it, kind of thing. But for the patients that do feel the need for it, as long as they're consented, which these ladies, they're not going to give it up if they feel bad. Right. And my patient that was in her early 80s, she told me I was going to write it endless refills. So when she went to heaven, God was going to fill her estrogen pills. And I said, yes, ma'am. She was about it. She knew her body, and she knew what made a difference.
Right.
Yeah.
Individual again, just doing what makes a difference. And let's revisit it, because we talked about really like mindful eating, exercise, and sleep are 3 things that are really key to getting out ahead of it and feeling good. Menopause doesn't have to end anything. It can be the beginning of something too. It's a great way to look at it. Let's talk a little bit about, we touched on yoga and meditation and other kinds of ways, tapping, talking things, but all of these things might be like adding up in someone's mind, like, I don't know where to go for that. I don't want to pay classes. Really, walking, just get out and move. And I've always thought movement in your day creates movement in your life.
Yeah, because
so
and
just
even
walk.
My physical therapy daughter says, even just if you've got a desk job, just stand up and sit down every hour.
Yeah.
And that takes you out of the sedentary section. Walking is wonderful, and I think that's why we have to make sure we take care of our bones and our joints. But weight training is also important.
Yes.
Now, it was always very vague. They would say weight-bearing exercises, but nobody would ever define that. It was always, I use slow exercise, and I've been using my guy for 25 years.
Yeah.
I started in my mid-40s. And of course I was doing a lot of other exercise at the time, but it's slow exercise, it's Nautilus, so you have weight going up and weight coming down. And he does his little numbers. I don't even want to know what it is, but I go for 20 to 30 minutes. It's really 15 to 20 minutes once a week.
Yeah. And
he doesn't encourage me to come any more than that. I kind of bugged him to do it for a little while, twice a week, and I didn't see as much progress.
Yeah.
And so, that's another thing where it's really important, because there's a lot less bone issues. And there's tendon, there's all the fibers stretch, all that kind of thing, but you mustn't hurt yourself. So if I have someone who has osteoporosis or even osteopenia, I want them to go to the PT people and learn how to do the exercises correctly. I don't want them to just go and lift some weight that's too much and they fracture themselves. Well, we've lost the whole show there. So I think it's really important to educate and do that. And yeah, you don't have to sign up for classes. And like we said, you have the podcasts. Although being in a group makes a difference.
It really does.
It really
community
does.
matters too. I think that would be the fourth thing if I was going to add something. Community.
Yeah.
Yes, some kind of community.
The
classes.
the socialist stuff, socializing, and especially in older people, because they need to get out of the house. But again, I think the podcast stuff really changed, because that's what helped me get through COVID. And I just started. I luckily found a couple of them that I totally loved, and I watched all 104 podcasts of one of them. But it made me feel like I was leaving the house, but I was safe.
Yes.
And I think the other part we always have to think about is safety, and that's anytime you take a medication, you want to make sure, and with hormones, you want to make sure the patient's up to date on their mammograms. Most important. And a lot of people are very good about doing it, but a lot of people don't do it so much. Or with COVID, we got off our schedule. Like I used to always do mine every March. Well, now I'm in December, and it's going to be January because it has to be a year and a day for insurances. So. So you want to make sure their mammograms are good, because you don't want to, estrogen does not cause breast cancer. That was a big thing that's come out over the years, but you don't want to feed breast cancer estrogen or testosterone, mainly estrogen. And so we hand them an order sheet. We really get tough sometimes. And every once in a while they slip through, and of course it's America, but I think that's an important thing. And then adding the bone density. And now people know to ask for the bone density. Mm-hmm. So I think that's important. So doing your screenings, colon cancer, now they've moved it down to 45, and we even have something as simple as Cologuard. It's, you just get a box and you put something in there and send it off, and it really makes a big difference instead of being prepped and having to be a procedure kind of thing. So I think any of those things, good screening makes a big difference, but I also think hormones can make a difference too.
Right. And just paying attention to yourself, know yourself, give yourself a break, and look for any kind of change, and go see about it. But walking, mindful eating, getting enough sleep, community, all of those things add to it.
All are a big part of it.
And to remember that menopause can be a new beginning for something really good.
It's a new chapter, and it's very liberating. There you go.
Liberating. That's what we need. All right. Dr. B, thank you so much for being here again. We really appreciate it.
Thank you.
We'll see you again next time. You come back. We'll talk about sleep and all of those things more extensively. So be great.
Exactly.
All right.
Thanks.
Thank you again. And everyone, thank you for joining us. You can download a new episode of these discussions every other Wednesday morning wherever you listen to podcasts, and we will meet you right here next time on DocTalk.